All right, good morning, and thank you for keeping it Citizen Television. We appreciate your time and company. Health and lifestyle begins right now. It is Wednesday, and we want to talk about diabetic neuropathy. We want to talk about how diabetes affects the body in different ways and what can be done to manage a situation whereby you're experiencing your nervous system having been affected as a result of the complications caused by diabetes. But I'm not the expert. I have the expert with me in studio to break it down for us in simple terms and also to tell us, how it presents and how the whole, setup of the body is affected. I'm talking about Herbert Mwanyasi. Herbert is a clinician and diabetologist. Karibu sana, Herbert. We are happy to have you on Health and Lifestyle today.
Thank you so much.
Yeah. Happy New Year. We will say this to every person we are meeting.
Happy New Year to you too.
Happy New Month as well.
It's a good year.
Yeah. So far, so good. It's been kind to you?
Completely.
Oh.
Full of peace. I'm glad to see this year.
That's good to know.
Yeah.
So let's begin our conversation on the condition we're tackling this morning.
Yes.
Diabetic neuropathy. Usually I like starting from the very basic to just break down what this means. There could be somebody watching and they are even presenting some of the symptoms I know we'll talk about later, but they don't know what this is.
Yes.
So just to break it down for us, what is diabetic neuropathy?
This is a condition which is caused by diabetes, which is poorly controlled. And it is a condition whereby the limbs develop some pain, some tingling sensation, some burning sensation. Sometimes you get some numbness. And this is because the patient is diabetic, maybe type 1 or type 2, and he has been having poor glucose control. And because of that, the body, there is poor, the body supply to the limbs, the blood supply to the limbs become a bit affected because, when the sugars are high all the time consistently, it happens that the sugar affects the blood flow. There's a blood vessel called, in technical time it is vasa navoram.
Vasa navoram.
Vasa navoram. That blood vessel, it gets clogged because of the poor blood sugar control. And then the blood becomes even thick, and then it damages that blood vessel. That blood vessel supply blood to the tissue, which is called myelin sheath. That sheath is the one which covers the nerve. So when it is affected, the nerve, the nerve will not get nutrients. So it starts becomes damaged. It gets damaged. So in the process, the signs and symptoms, they come like burning sensation, tingling sensation, pins and needle sensation.
Also, you feel like kuna vitu zinakudunga and you can't understand.
You cannot understand.
This is if you're a patient
of
managing diabetes.
Yeah. So there's tingling sensation, there's burning sensation. Sometimes there's numbness, complete numbness of especially the limbs, upper limb and lower limbs, mostly the lower limbs. And then also the feet becomes very cold. Sometimes feel very cold. Sometimes you feel very hot. Yeah. All
right. Let me take you back to just talking about, let's talk about diabetes first.
Yes.
How common is it in terms of approximations you can share with us in Kenya, and probably do all patients of diabetes get neuropathy? Let's talk about how common this is.
It is common, especially it is common currently, because currently, like where I'm working in the hospital, I work in Kenyatta National Hospital, diabetes clinic. And per day we get around 4 new patients.
4 new patients.
4 new patients, 4 to 5 new patients, diabetic new patients, fresh
cases.
Fresh cases. So it is common. Let's say in a population of in 10 people, at least 2 or 3 have got diabetes. So it is quite common these days.
But does it mean now that every person, as long as you've been diagnosed with diabetes, you you get neuropathy, or there are others who don't get to experience this?
The problem comes because the sugars are not diagnosis matters, early diagnosis matters, because this is just a complication of diabetes.
Okay.
So when the person is not diagnosed early, before that complication comes, they are affected. But if the person is diagnosed early, the condition is diagnosed early, that complication can be taken care of, because not all of them have the neuropathy. Those who have the neuropathy are those who come late, and then the management of sugars is poor. Yeah.
So just to understand you in terms of causes,
yes.
Just to explain it further, does it mean then that if you do not manage your diabetes on time,
yes.
then it gets worse and it begins to affect the functioning of your body and through the nervous system?
Exactly,
yeah?
exactly,
yeah?
exactly. If it is not managed early, if the sugar is not, if the condition is not known early and managed early, maybe with the treatment, with lifestyle changes, and with the diet, it manifests.
All right.
Because the most important thing is to control the sugars. So when the sugars are high wire, they're not in control. Now the sugar itself is the one which damages the blood vessels and the nerves, and which means that early management, early recognition, and early management will help so much.
All right. I know. I want us to understand. Like usually on this show, I like to take people to even look at how the body is made up and how the specific condition we are addressing is affecting which part of the body.
Yes.
I want us to look at the pathology, the human pathology.
Yes.
And I know we have some illustration that I would just like us to observe as you explain to us. How then this condition affects the body. From the information I have, sometimes it can cause even you to have ulcers in some parts of the body,
yes,
on your feet and the like. So maybe if you can have the pictures up so that at least we can have an illustration of what we are talking about. To just look at the makeup of the body, the feet, the head, and just to see how when you have diabetes and it's not managed on time, then you stand a chance of getting neuropathy, and then we'll break it down further. Okay. But just talk to us about, as we wait on the pictures to be put up, you just tell us a bit about some of the signs and symptoms, as you run us through this illustration.
Symptoms of neuropathy. Okay, some of the signs and symptoms of neuropathy, diabetic neuropathy, are, as I've said, that there's burning sensation, there's tingling sensation whereby you feel as if there's something moving on the skin. And then there is also, you feel hot, the body, the limbs feel hot, even sometimes the body feels hot. Sometimes the patient can tell you that there's something touching here and there of the body. And then there is coldness. Sometimes the feet feel very cold and numb. They cannot, even when you touch the patient when he touches himself cannot feel that sensation. So normally, what I can say is that we'll say it is a peripheral nerve problem. Because we have got, of course, we have got central nervous system, we have got peripheral nervous system. We have got another system called autonomic nervous system and motor. So these are nerves which supply to the tissues. There's the motor, there's the sensory, and then there is autonomic.
I'm being told that we have the picture now, just so you can run us through what we are looking at.
Okay.
Take us inside the human body and just see how neuropathy affects us, yeah?
So like that, like here, a vessel, just a vessel, normal vessel, like I'm saying that the normal blood flow, like that one when you see that normal vessel, normally blood flows to the tissue, that's an artery. And it is supplied, there's a nerve which supplies that blood vessel, and that blood vessel supplies the nerve. So that's a normal vessel. But when there's abnormality, it is whereby there is the blood vessel has narrowed, or has been damaged. Like when you say the other side, the blood vessel is damaged, And also you can find sometimes, most of the time, the inner line of the blood vessel has got some cholesterol impacted with cholesterol. We call it atherosclerosis. And then also the blood vessel narrow. That is the blood vessel which is supplying the nerve.
So it restricts the flow of blood?
It restricts the flow of the blood. So it is narrowed, and then there is a poor flow, and then the blood tends to gravitate, it tends to slow down. And then it causes something called the thrombosis. Thrombosis, whereby the blood is, it becomes
it's like it's clotting.
More viscous. It is clotting. And then that's the place where now it blocks now the flow of the blood completely. And now it cuts off. Now that blood vessel also gets damaged. And you know that is the blood supply to that nerve. So if the blood vessel does not pass enough blood to the nerve tissue, that nerve tissue gets damaged.
All right.
It starts getting dry, and it gets damaged, comes because anything which does not receive nutrients, it gets damaged.
All right. Just as I look at the picture, there is I can see an ulcer on the foot. Yeah. So just explain to us how that comes about as well. That some diabetic patients would be having, some wounds, and they're wondering where is this coming from. So just to talk to us about that as well.
That ulcer comes about. It can be a venous ulcer. It can be an artery ulcer. Just ulcer at the end of the blood vessel, at the skin. It comes about because when there is poor flow, and there is that blood vessel has been blocked. The one I was saying, the vasa nervarum, has been blocked and is damaged. So that place becomes soft. The tissue, if it is not being supplied with the blood, it becomes dead. The tissue they start dying slowly and slowly. So in the start dying slowly, there's something we call it necrosis. Medically, it's called necrosis. First of all, we get that we get that thrombosis, and then we get after necrosis, we get ischemia. There's something called ischemia. So that ischemia, then the tissue just...
So the ischemia affects the skin, or...
It affects the tissues now.
The tissues,
The tissues that are being supplied by the blood vessel.
All right.
So that place with the time, because it's not getting any nutrients, it softens up, and in the process, it is easy to break up.
All right.
Because it is not getting enough supply of the blood. Tissues are not receiving tissue. The tissue are not receiving enough nutrients, because the blood vessel supplies nutrients. Yeah. So if it's not getting nutrients, it starts drying up. It becomes dead, like a dead tissue.
It starts dying off.
It dies off. So when it dies off, it is easy to break off because it is so friable. It is at the distal part, it's at the end of the linear of the nerve, the blood vessel. And also the nerve has been damaged, and the patient is not feeling the pain. So even when the patient is crushed by anything, he does not know, he cannot...
All right, so before we get to the pain and the lack of feeling that sensation, can we have such ulcers appearing in other parts of the body, for instance?
Yes. We can have, there are neuropathic ulcers. We call them neuropathic ulcers. And there are those we call non-neuropathic. Those are venous ulcers. Neuropathic ulcers are those ones whereby are normally in the weight-bearing areas. Okay. Those ones are mostly, you find them at the pressure points of the feet, maybe at the back of the feet, at the heel, like that one. And then even at the large toe, that side, or even at the low side.
So at the pressure points, yeah?
The pressure point. Even that, I think that is a partly venous ulcer, but at the lower part, you can get really a neuropathic ulcer. Those happen at the pressure point because of the weight-bearing areas, and because the patient, those nerves which are affected are those nerves which are called sensory nerves, the nerves which supply the tissue sensation. So when the patient steps on the ground and is not feeling that pain, it is easy, even if when he's scratched by anything, when he steps on something, it comes, that comes.
All right. There's a question I'm just curious. Sometimes you hear cases of a diabetic patient. When it comes to their experience with pain, it is on two extremes. So a certain category will say they feel like the pain is too much. They are so sensitive. The pain is exaggerated a bit, for lack of a better term.
Exactly.
Others will not feel anything at all.
Yeah.
So explain to us the dynamics around this. And I'm more concerned about those who don't feel pain. For instance, if I have a wound and I'm not feeling pain and I don't know it's there, how disastrous can that be?
The pain, there's a difference. There are those which affect, there are not those nerves which supply the blood vessels, and then there are those nerves which supply the tissues. So I think what I know is that nerves are affected differently. There are those which are called now motor nerves. There are those which are called sensory, and there are those which are called autonomic. Autonomic are the ones which affect the automatic things, like maybe the opening of the blood, the skin pores for respiration, for sweating, and the motor ones. The motor ones are the ones which control the movement, maybe the movement of the body, movement of the limbs. So if the sensory are affected, there's a change. Maybe if they are not affected, the patient will feel a pain.
All right.
It depends on which side.
To make it easier, let's run us through the types of neuropathy, because you've talked about the different types of nerves. So as you categorize them, maybe you can tell us this specific, like the sensory nerves, if they are affected, these are some of the things that the patient may be unable to do or may feel or may see. The autonomic, this, if it is this way, then so that at least maybe somebody could be going through that and they don't know. So
I'll talk about peripheral neuropathy. The sensory neuropathy. That's whereby the patient will feel those pains. When they're affected, it affects the sensory parts of nerves. And the patient feels that tingling sensation, that burning sensation, all those changes, the burning, the tingling, and sometimes it feels cold. It depends on the extent of the nerve which has been affected. And autonomic, it is the one whereby it supplies the body areas whereby there is autonomic activities, like automatic activities, let me say, like opening of the pores of the skin, like the GIT movement like when the food is being moved into the system, peristalsis. Those are the ones those are the autonomic system. And then also it controls the heartbeat. So when autonomic is affected, when the autonomic system is affected, you get somebody has got constipation, somebody has got a lot of stomach problem, bloating, somebody has got a problem with the skin is dry, because it also affects the perspiration, the sweating and all that. They are not
sweating.
It becomes,
some are sweating too much.
Sometimes some don't sweat. It becomes very dry. You start cracking up. It becomes, even the feet, they become cracked. And then the heart does not function properly. Sometimes you get somebody getting something called orthostatic blood pressure, whereby when he changes position, the blood pressure goes up, sometimes goes down. There's that dynamic because of they're affecting the blood, the system of the heart, the systems which are automatic. So, and then the motor system, when the motor system is affected, it is with movement. And when this one is affected, it affects mostly the muscles and the tendons. So when the tendons are maybe are affected, you find that there is changes of the deformities come slowly, and there is something. The body, the toes might become. We get something called cloto. You get something called binuno, whereby there's some hardness. There's some diversion of the bigger toe. It is somehow. Changes this way. Yeah, posture. Yeah, exactly.
Yeah.
They say it is subluxation. It is a kind of dislocation of that joint. And sometimes you find that the movement gait, the movement is affected. The arcs are affected. You know, the arcs. There's in the foot. Normally, a foot. There's two types. I'm sorry I didn't bring that in earlier, but normally a foot has got two arcs. There's middle arc and there's lateral arc. And the middle arc, that curve, which normally, that curve.
That doesn't touch the ground.
Yeah, that doesn't touch the ground. Yeah. You're not from Europe.
Yeah.
So when that one, because of the muscles are affected, the muscles of that's the nerves that supply the muscles to those arcs. You know, there's some kind of system of nerves, tendons, and everything that controls the movement of the foot. Maybe the foot moves.
How it touches the ground, how it lifts. Yeah.
Like they say, it is act like a landing of an aeroplane. So when that's affected, when those nerves, the motor nerves are affected, also the foot is affected, the muscular foot. The muscular part of the foot is affected. So you can get a flat foot. And in the process, that foot becomes flat because those structures which hold that foot have been affected.
So even your movement is affected.
Yeah.
The foot is not moving in the normal way that it's supposed to be moving. Yeah. Like an aeroplane. I like that.
Yeah, like an aeroplane, yeah.
It touches na nyuma kwanza, then mbele. I like that. It simplifies things for us. Yeah. But can it affect maybe the urinary, the reproductive system, this neuropathy?
You're very right.
How, yeah.
It can, because that's an autonomic system also. Yeah. Urinary system, reproductive system, it affects because we find that there's the flow to those tissues are affected, especially for man. I get patients who come with erectile dysfunction, and it is because there's poor supply of blood to the penile tissue, to the blood vessel that supplies the blood vessels, which supplies blood to the tissue, has been affected.
Okay.
And also for the women, so because of the lack of the normal, there is the changes of mucosa because of the nerves, because of that normal autonomic system has been affected. They can get infection very easily. Their normal anatomy changes to some extent. Yeah.
So urine, sometimes you cannot hold.
Sometimes you cannot hold urine well. Problem with the urine incontinence.
Yeah, that's why I was very specific on that, because many diabetic patients will tell you that they're having a challenge in controlling urine.
Exactly, yeah.
So I just wanted us to understand the nexus between diabetes and that particular malfunctioning of the body.
There is a lot of, it affects that kind of thing.
So generally, diabetes can, just to simplify it, can affect the body in different ways. It can affect the nervous system, and then that results in a situation where the normal functioning of the body is affected in different ways.
Exactly. It can affect so many areas.
So if you're a patient, you have diabetes, and you're experiencing any other symptom aside from the blood sugar variations, then you should get checked, because it could be anything. It could be neuropathy or anything else.
It could be neuropathy. Yeah.
All right. Let's talk about how that diagnosis is done to really zero in to identify that this is neuropathy. How do you do it?
Okay.
Okay,
the diagnosis is done by, first of all, you take the history of the patient. When the patient comes to the clinic, you ask him questions concerning how she or he is feeling. And when the symptoms now point, he tells you maybe the times I get tingling sensation. Sometimes I get burning. Sometimes I get this way. Sometimes at night I don't feel sleep completely. Maybe if it is urogenital, it tells you, oh, I cannot hold my urine. When I go to the toilet, I have to rush very fast. And so the history itself matters. And then secondly, like the feet, we normally do some tests. We use a monofilament. There's something called monofilament, whereby it is the one which tests all the sensation. We do it practically to do it is a kind of a gadget which tests the sensation of the patient. We use the feet. We use the feet at the lower part of the feet, and then they test the senses, how the patient is feeling. We can do other things. There's something which are other gadgets we use, like in something called neurotip. Most of the things is physically. Maybe we do history, we do inspection, and we do some investigations. We do some physical examination. Using that monofilament, we test. We use a chewing fork. Also, we use it, and then we can gauge the level of that neuropathy.
All right. So out of the patients you receive, you said you receive, like, is it 4 cases?
Per new cases.
4 new cases per day at the facility that you work for.
Yeah, exactly.
In terms of just sieving to see how many then do you diagnose with neuropathy out of this population?
Okay. There are not many. Let's say it depends. Sometimes you get at least 1 or 2. You know that those ones who come late, but not all of them who come late. Some come a bit early, and some are picked during the time of maybe you are doing medical camp. So at least 1 or 2 in that 4. 1 or 2 you can get.
But it usually depends on how the diabetes is managed. That is what will inform whether you get neuropathy or not.
Exactly.
All right. So what are some of the misconceptions you've had? This show is all about demystifying the misinformation and misconception. What have you heard that people say about diabetic neuropathy that, as a professional, you'd like to clarify or correct?
Yeah, they could say maybe. They can say the witchcraft. It's not a normal thing. And some say that it can be handled in traditional ways. Yeah, because something that maybe when they use the normal herbs and all that, it can be healed. And some say that it can be something to do with witchcraft. So it depends. So I think the only thing is to, although not many of them come with such a misconception. Before it is the time when after education, people have understood. But before there used to be a lot of misconception about witchcraft, about this thing can be handled with herbs. It can be taken care with herbs. Yeah, so we try to...
Because you can imagine for a Kenyan who maybe is not that informed, so you have this ulcer, and it's getting worse, and you're not feeling pain.
Yeah.
So how do you explain it? You say it's witchcraft.
Sometimes say it's cancer,
which could be wrong,
yeah, which could be wrong.
So once you do the diagnosis and you identify that it's a case of neuropathy, how do you manage the different types, and what are the treatment options that are there?
Okay, so it depends on which type of the case. When it comes to diabetic, it comes to neuropathy, whereby it is peripheral, where they maybe affect the feet. If it is early, where the wounds have not come up, there are some. We teach the patient health education. We tell the patient to take care of his feet, to be checking. First of all, there's education to be checking on his feet every day. Make sure that the feet are well cleaned, and even in the interdigital areas, they make sure that they wipe completely. They check on the feet completely every day to check if there's anything that can be, maybe anything in the shoe or maybe any wound. They should be doing it every day. And then also they make sure that they wear good shoes, shoes which are not high-heeled, but normal shoes which have got very good sole, soft sole, but firm. Make sure that they do a very good, well-padded shoe with a good sole and wide. You know, when it is very narrow at the end, it causes friction when the patient is moving. So we tell them wear a wide shoe, which is wide at the front and the back. Let the toe box be wider and soft, but firm, and at least thick. That's for the education. Make sure that we tell them the sugar. They make sure their sugars are very well. They buy the machine and check on their sugars daily. If they cannot do it daily, even weekly, they check on their sugars well and make sure that the sugars are well controlled. And then medically, there are some drugs we give for the peripheral. There are some drugs which we give. Mostly these days we give a drug called pregabalin, gabapentin for the patient with different doses, and some tricyclic. There's some which are called tricyclic type of drugs. Also we give them, and also vitamin B12 we give them. If there's the GIT also, it is all of them. It is sugar control. You know, the sugar control is the main thing. You know,
what's like the role of blood sugar in probably controlling, you know, the progression of neuropathy?
The role of blood sugar is very much important in progression, because the poorer the control, the faster the progression. Because when the sugars are not controlled for a long time, the faster the damage of the nerves. So we really capitalize on really proper control of blood sugars. They make sure that their sugars are well controlled. They diet also, whatever they eat, and exercise, and also the medication. So it's a multidisciplinary thing. We combine it. And where I'm working, we normally, after seeing the patient, I also take him to the nutritionist for more guidance, and maybe even sometimes we even take to a physiotherapist for more guidance. So it depends on what?
On the condition they're presenting. Yeah. But then let me just ask you, what do you think are the lifestyle changes that a patient with diabetes can incorporate to really help them manage the chances of developing a neuropathy?
Yeah, the lifestyle changes the most important lifestyle changes are, first of all, diet, management of diet, proper diet. They make sure that they eat the right diet, whereby maybe they make sure that they eat high fiber diet in terms of carbohydrates. Maybe the green vegetable. Also the proteins. The food which has got a lot of fiber. And exercise, of course, that's one part of lifestyle changes. They need to do exercise. You know, the more you do exercise, the more you cut off the sugar, the insulin. The more you do exercise, the more the sugar is broken down. You know, when you do exercise, there is that breakdown of sugar. And, you know, the body loses a lot of fat and a lot of excess sugars.
Having an active lifestyle, you know.
Very important.
we are in a society where things are becoming a bit too passive these days. We sit a lot in offices and all that.
It's true.
Yeah. I'm concerned about the number, 2 to 4 cases per day.
Yeah.
What does this tell you as a professional in that field about where we are at a society? Because for me, those are very high numbers, if you ask me.
It's a high number, it's true.
4 new cases per day,
yeah.
Cases of diabetes per day. That's quite alarming. What could be happening from your analysis?
What I think could be happening is because I think one thing can be because of a lack of being aware. You know, people who are sometimes they just ignore things. You know, somebody does not go, you know, there's that type of somebody goes to the hospital to be examined, to be seen, to do health checkup. There's that aspect. Also, another thing is that our lifestyle, diet, the types of diet people eat. You know, these days the people in town eat junk food, a lot of junk food, a lot of chips. The chicken they eat is the chicken which has been the broiler, which has got a lot of, I think it has got a lot of steroids because they use a lot of the medication. And then people are not doing exercise. And our habit of going to the hospital also has affected so much because people don't go to the hospital unless there's something which is...
Unless it's near there.
There's a problem. When there's a problem, that's when somebody goes. Because I guess sometimes a person comes, he has got eye problem, you know, it affects the eye. So he's referred from the eye to the clinic. Yeah, he's not seen properly. When the sugars are done, they're high, and that person is not aware. So you start now managing the sugars because that person, he didn't know that he has diabetes, but he has got eye problems.
So they went to the optician.
Yeah,
to get their eyes checked.
Yeah, exactly. And then the optician senses that the sugars are not good after checking on the eyes. So lifestyle changes, lack of going to the hospital. And another thing I have seen these days is stress. Level of stress has risen up. People are very much stressed, I don't know, because of the financial status, the issues of finances, the economy. And you know, stress is one of the things which also causes, it is a predisposing factor to sugars going up. Because when somebody is stressed, the sugars go up. There's a way the body releases some hormones when somebody is stressed. They call them cortisol, adrenaline. Those hormones, when somebody is stressed, those hormones are released. Continuous stress releases those hormones. So in the process, those hormones, they cause increased sugar in the body. So the more they stress, the more the hormones are released. And in the end, you find that person becomes diabetic because the body cannot control that sugar.
All right. Can neuropathy be cured or reversed? Having taken us through the treatment options, can it be cured or reversed?
It depends on the level of... If the nerves are completely damaged, it can just be managed because you manage the pain. But if it is not very much damaged, because there's what we call the myelin sheath. The myelin sheath is the sheath that covers the... I think in that picture.
If you could have the picture again.
The myelin sheath.
Yeah, so... Maybe we could have that picture again or up so that...
I think it is there.
Yeah,
it is there.
So that we can get to see what you're telling us.
So okay, in brief, it is a covering of the nerve. That myelin sheath is a covering of the nerve. So if that sheath is damaged, that cover is damaged, and the nerve is completely damaged, it becomes very difficult for that patient to heal. That you'll just manage symptomatically. But if it's not damaged early, if it is not damaged so much, at least we have discovered it early, then it is easier managed because now we can reverse it by controlling the sugars. We can reverse it by changing lifestyle. Yeah, so we advocate for early diagnosis.
Early diagnosis.
Yes. Yeah. The early the diagnosis, the early the management
can be managed. But then what other therapies are incorporated in management in cases where only management can be done? Do we have other therapies or things that are done to manage?
Okay, so we also talk about physiotherapy, massaging of the feet. We tell the patient to massage the feet for proper flow. There's a way the patient can be massaged the feet. The feet are massaged so that where there's blood flow is not very good, it flows. That's one of the therapies that can be done. Mostly most of the therapies are conservative and protective. The massaging, the wearing of the shoes to prevent damage of the wound or of the feet. And also, if there's a wound, we debride the wound now. That's the time we get a diabetic foot specialist, a nurse, who normally debride those wounds, because there are those wounds which come at the pressure points, even those ones which are not at the pressure points, they are debrided. They are debrided so that you remove that dead tissue until you find the place which is bleeding. Because when you get the bleeding part, now it is easier for the patient to heal.
To heal.
Yeah. And then also
And funny thing, sometimes this wound can be like that and you're not feeling anything if you have diabetes.
Exactly.
Yeah, so it can even develop infections because you're not feeling pain and you feel like it's not that bad, I'm not feeling pain.
Yeah.
But then the more you stay with it, the more, you know, it becomes worse.
The more it becomes
and you
worse,
can develop infections.
Exactly. In fact, infection is one of the things that we really try to avoid, because sometimes you can get, if it gets infected, also it can develop to something which is called gangrene, whereby the tissues become affected by another bacteria, which is very, very fast to attack the tissues. So we, especially the tissues which are not getting enough supply of the oxygen. So we make sure that early diagnosis, and then when the patient comes, we make sure that we debride the wounds, and we also dress them, depending on which side we dress them. And sometimes also, if they are at the pressure point, we also try to do some, we allow the patient not to use the foot so much. We can use some crutches
to support
the wound so the wound can heal faster.
Okay.
Sometimes it might even admit the patient and do because when the wound is not managed early, it can develop, it can worsen, and we can get amputation. Yeah.
Oh, it can lead to amputation.
It can lead to amputation. Yeah, if the wound is, it continues to get worse and worse, and it eats the other part of, you find that even you cannot continue to wash it, to cleanse it, to debride it. So you have to cut off the wound, the foot, maybe the foot or even the limb. So it depends on the extent of the wound.
What is the role of healthcare providers in preventing, the advancement of some of these cases? Because like the example you gave us, the eye complication.
The eye complication, yeah.
I'm trying to imagine there are so many people who go to the medical facilities, they get diagnosed with different conditions without knowing that it's diabetes.
Yeah.
So by the time it's realized that this person has diabetes, it's probably after they have developed the neuropathy.
You're
so
right.
what do you think can be done to change that space also? How can healthcare providers also help to avert these cases?
I think the role of care of providers, the healthcare provider is very important. His role is very important because he's supposed to examine the patients who come to the hospital very well. There are times when some of our healthcare providers, they don't take time to examine the patient. Some patient comes and says, I'm just feeling this pain, and he just gives a painkiller and that goes. But the healthcare provider is supposed to be very, very systematic. When the patient comes, he must make sure that he checks on the patient, all the patients, he examines the patients, he takes the history very well, and make sure that he examines even the feet. Because sometimes even in diabetic, sometimes people just bypass the feet, and sometimes until there's a problem. So I think for a healthcare provider, he's supposed to proper examine the patient, take the history properly, and diagnose. They should diagnose early, because if they don't diagnose early, this patient goes home.
All right.
Other cases, I've seen other cases. Somebody goes, is treated with that's something else. That's not even diabetes, but because of misdiagnosis, people have got complications. And they come with very bad complications because they're being misdiagnosed in hospitals. So I believe healthcare providers need to be educated well about conditions, and they need to make sure that they do diligently. They make sure that they examine the patients very well for proper diagnosis.
All right, thank you so much for creating time for us. Maybe your final word, You've taught us a lot that we didn't know about diabetes. Many just thought it's about the blood sugar levels, but it seems like it goes beyond just the blood sugar levels.
It goes beyond.
Yeah. So your parting shot as we wind up.
I would say that diabetes is there and it is really affecting many people. And it is the time that we need, as healthcare workers, we need to rise up and work on it, do early diagnosis and really work on it and make sure that we reduce the cases of death and cases of amputations and complications. You know, when we work together as a team, like I work in Kenyatta and the other hospitals, we can have a work kind of network. We refer each other, we collaborate with each other, and we try to see whether we can be able to handle cases, even online. If that can be done, it can really help to sort out many problems.
Problems. Thank you so much, Herbert Mwanyasi. He's a clinician and diabetologist. We were talking about diabetic neuropathy today. Thank you. I believe that now you know. In case you're a patient and you are showing some of these symptoms, you don't know where they're coming from. You also need to know that your immune system is also compromised. So the earlier you go to a medical facility to get checked and to get assisted, the better. But in case you don't even know that you have diabetes, I think out of curiosity, it is a good thing that you should just visit a medical facility and get your blood sugars checked. You just never know. You had Herbert saying some people would present with eye complications only to realize that they had diabetes. It could be anything, heart problem, whatever it is, just go and get checked. It's better to be safe than to be sorry. My name is Safina Chengoma. Thank you so much for watching the show today. We do this again next week, but for now it's a wrap. Enjoy the rest of your day.